Good morning. My name's Olivia. I go by Olivia K on Facebook, Ollie K on Instagram, and WarmYam 9800. I go over nursing material for nursing school or NCLEX mostly. I also go over like reality TV shows for fun to decompress and maybe documentaries on TV shows. So I haven't done any nursing related stuff in a while, so I like to go over pain meds because it is high yield, believe it or not. There are some important considerations that people need to be aware of when they're answering pain med related questions. So I'm going to start by introducing the fact that pain meds should be high yield, especially opioids, because they are notorious for causing respiratory depression. And NSAIDs you want to usually avoid with patients with kidney or liver issues because they can cause what's called GI bleeding. I'm going to start with opioids. So this is a star and underline point because, like I said, it causes respiratory depression. So your examples would be morphine, which no morphine I haven't given, morphine, fentanyl, morphone, sorry, mouthful, I apologize, Dilar, which I've given, and oxycodone, which I have, or I do give indeed every single day. So it treats moderate to severe pain. So the most important point to know about these meds, especially if you're seeing in your Q banks or ATI, or in the NCLEX, which you may have some pain related questions in the NCLEX, is that it is known again to cause respiratory depression. So you need to hold that the respiratory rate is less than 12 at 12 a minimum. And it can cause sedation, so definitely watch out for that. So you see your patients are falling asleep while your nurse is talking. That's an alert. That's something you need to be aware right there, and be alert of, and be cognitive of. And then it can cause constipation, which is why most of these patients are on docosate sodium, or are also known as Colace and Senna. And then it can cause hypertension. So the antidote, which I'm going to do on a separate video one day, maybe next week or the week after, is naloxone. That's your antidote. Okay. So I'm going to go over to NSAIDs next. So this is another highly tested point you can see on the NCLEX or your Q banks, or again, like your ATIs, whichever Q banks you're using. So your examples will be your ibuprofen, Tylenol, or APAP, I like to call, or acetaminophen, naproxen, ketorolac. I don't think I've given that before. So, but I have given naproxen and ibuprofen and Tylenol. And I do take Tylenol here and there. Okay. So it treats mild to moderate pain, inflammation, and fever. So this is another star and underline, whichever way you it gets you to understand. So it does cause GI bleeding, as I was mentioning at the beginning, and it needs to be avoided with patients. Avoided or used with caution, rather. Used with caution, because sometimes these patients can have this medication. Used with caution with patients with hepatic compromised patients. So that's, when I say hepatic, I'm talking about liver. So anytime there's a liver issue, especially with Tylenol, be careful with that one, okay? So APAP needs to be avoided or used with caution with hepatic compromised patients, as I just said. Sorry about that. Examples would be patients with liver failure, patients that just had like a liver transplant and their body's trying to get used to it, in hepatic encephalopathy. And the reason being is that liver is one of those organs that metabolizes the medication, right? So you want to be cognizant with NSAIDs, especially Tylenol, or like I said, APAP or acetaminophen. Also, you want to avoid patients that have kidney diseases or history of stomach ulcers. Again, GI bleeding. So if a patient is reporting black and tarry stool, please you want to hold the medication or report it to the PCP or tell them to stop taking it. And if for those who don't know, and I'm sure you're going to go over in nursing school when you do pharmacology, the maximum dose of acetaminophen, or like I like to call it APAP, is 4 grams a day. So that's 4,000 milligrams. And don't ask me to do dosing calculations because I am horrible with that one, and maybe someone else will be better at it. So I can link that if someone has any questions about it, but I'm not doing any of that. They don't even ask you dose calculations a lot on the NCLEX. Anytime I've taken it since I became a practical nurse, I haven't even seen any of those questions. So if you do, maybe that I can direct you to some sources there. But anytime I've taken the NCLEX, because I've taken it only 3 times, I've never seen a dosage calculation question on it. But anyways, I was just telling you to so that way you're aware and whatnot. Okay. So I know that's not a point. I'm going off tangent. Okay, so neuropathic meds. So sorry. So that's for gabapentin and pregabalin, which I have given those all the time, like especially gabapentin. So it's mostly for nerve pain. So just be aware of side effects such as drowsiness and dizziness. And the person, especially if they could have dizziness, or I know this doesn't cause sedation, but dizziness per se, the patient could have what's called increased fall risk. Okay, so I'm going to tell you to underline and start this point. So they need to avoid any driving or heavy activity when they're taking this medication. Okay. And last but not least, you have your adjuvant. I'm sorry. Okay. So your example is Flexerol, which I do give. And I think with that one, you want to avoid heavy activity and driving as well. And lidocaine patches. So that's used for chronic and pain conditions. So that's just a bonus. But yeah, with the Flexerol, and I mean this, avoid driving or heavy activities when taking it. So that's all you need to know about the pain medications. I'm going to talk about IV fluid, I think, tomorrow or tonight, actually, because I should have some time tonight. I'll get into that because I know that's very high yield. That's very important. So whether they ask you in the NCLEX or not is something you need to be aware of. And I will probably cover... I think I want to cover ABG because I think that's where most people get confused, because that's where I was confused and I had so much difficulty. And I'll leave some helpful links in the description so that way you can get more out of it. But I hope you've gotten some information out of mine. Anyways, take care. Have a beautiful rest of your day. It's sunny out, thank goodness. So take care. Bye.